Good morning. Dan Casey here, talking about compassion fatigue in a time of COVID-19. And we've got about an hour where we're going to talk about what compassion fatigue is and how it works for COVID-19, how make it work for them. So a little bit of my information. I'm a Green Cross and International Critical Illness Stress Foundation trainer. I've been doing this work for over 30 years. I've trained 10,000 people, lifetime achievement awards, blah, blah. What I'm showing this slide lets you know that I know what I'm talking about. And Green Cross is half my home. I started with Green Cross in 1999. It was established in 97. It was actually started after the Oklahoma City bombing. And Dr. Charles Figley was asked to set up, working with the mental health folks who were working in there, had nothing put together to contact them. And so we wrapped up the Oklahoma City bombing program, and Charles put word out, and 2 years later we had 1,200 members, and we've been working ever since. We are the premier disaster deployment agency in crisis field today because we are deployed to work with the workers. They're deployed to work with the victims. We're deployed to make sure that the workers get home. This hour-long program, I have three goals. Recognizing stress in yourself and others during the COVID-19 work, the pandemic. Recognizing compassion fatigue triggers and early warning signs. And being able to identify and utilize resources and plans for resiliency and for prevention for yourself and for others. Workshop objectives. We worked this out, got them down to just a few. Differentiate between compassion fatigue, countertransference, burnout, and vicarious traumatization. We'll talk about the array of symptoms indigenous to compassion fatigue. We'll do some assessment and identify symptoms of compassion fatigue in yourself and others. Recognize compassion fatigue triggers and early warning signs. Articulate current theoretical models for the etiology and transmission of compassion fatigue. And teach others the potential effects of traumatic stress. That's my objectives. A few definitions now as we go through. Compassion. Webster's definition is a feeling of deep sympathy and sorrow for another who is stricken by suffering or misfortune, accompanied by a strong desire to alleviate the pain or remove its cause. Compassion in a nutshell. Compassion fatigue is the cost to carry. Professionals who listen to other stories of fear, pain, and suffering may feel similar fear, pain, and suffering because they care. Sometimes we feel we are losing our sense of self to those we serve. Charles Figley wrote the first book, the seminal book on compassion fatigue, actually identified compassion fatigue for what it was and what it wasn't. There was compassion fatigue in families. Since then, there's hundreds of books out on it, but Charles is still the godfather and the grandfather of what we do. Identifying compassion fatigue. It is an occupational hazard experienced by those helping people in distress. It's a state of tension and preoccupation with the suffering of those being helped to the degree that is traumatizing for the helper. We go in expecting to run into compassion fatigue. In fact, when we deploy as Green Cross, one of our deployees is compassion fatigue for the rest of the team, just to make sure that we keep all our ducks in a row. We know if you have compassion fatigue, it often leads to poor self-care, extreme self-sacrifice, and can develop into PTSD, post-traumatic stress disorder. Statement by Charles. Those who have enormous capacity for feeling and expressing empathy tend to be more at risk of compassion fatigue. So the better you are at your job, the more empathetic you are, the more likely you are to develop compassion fatigue. How does it work with COVID-19? Study of almost 1,300 healthcare workers in 34 hospitals in China with clinics in COVID-19 found that a considerable portion of the healthcare workers were experiencing symptoms, depression, anxiety, insomnia, distress. Women, nurses, the clinic frontline workers were the highest risk. Some quotes from the hospital workers: nerves are starting to get to people. We all have children that are figuring out what to do with our kids. How fast can you respond to a code? It takes me 6 minutes to unlock my N95 mask. That person isn't going to do very well. So compassion fatigue is comprised of two parts. There's burnout and vicarious traumatic stress. Definition for burnout: a depletion or exhaustion of a person's mental and physical resources attributed to their prolonged yet unsuccessful striving towards unrealistic expectations, internally or externally derived. An end phase of severe distress. That is a Charlotism right to the top. Depletion, exhaustion. How do you know you've got it? Get into burnout. Burnout consists of characterized by frustration, anger, depression, exhaustion, just overloaded overwhelmingly. Emerges gradually as the person becomes increasingly emotionally exhausted over time. Each is its own thing, and together it is burnout. The other half of that is vicarious traumatic stress, which results when the individual is negatively affected through indirect exposure to traumatic events. Secondary exposure to very stressful and traumatic events through their work, mostly. So if you're the hospital workers, teachers, everybody is exposed to this all the time. Vicarious traumatic stress takes its toll. And as emergency services workers, vicarious stress is the demand we place on ourselves to be compassionate, helpful, and effective. That in itself is a good cause, part of the cause of compassion fatigue. Talk about preventing it. It is possible to prevent and or recover from burnout and compassion fatigue. Two ways for that. One is able to anticipate the risk factors and early warning signs. Know what to look for. As I said, when we deploy as a team, we have a compassion fatigue person for the team that's part of the team that has more power than the team leader as far as who goes and who stays. But the more likely that you can anticipate those, the more likely one is to effectively deal with the situation and become resilient in ourselves and in others. Go back to COVID-19 a little bit with compassion fatigue signs and symptoms and strategies. What do we do with compassion fatigue? The COVID-19 challenging times, full of change, uncertainty. Every day something new happens. Just heard from one of my coworkers here, just recovering from it again. Everybody's going to be near it, going to see some of it, and a lot of us are going to suffer it. So the mind, one of the reasons that we have a hard time processing is our mind interprets the situation as a threat. It responds with nervous system activation. And so the things that we typically do are causing us much more stress because this always is hanging over our head. Coping with stress in challenging times. What makes something stressful or traumatic? It varies upon certain things. The person, your life experiences, the work you do, your environment, the event itself. So if four of us deploy to one given place together, it'll affect all of us the same way, but different ways, different times, different things. One thing that doesn't bother me at all may bother you a lot, and so on. So one of the things we do for coping with it is being able to process it, talk about it. Coping with stress during the COVID. They said what is stressful to one, not necessarily stressful to another. Again, and what is a normal reaction to a stressful traumatic event differs from person to person. If you've been around a lot of this or in this type of work, it'll be much less stressful than someone that's coming in from the outside, not knowing much about it and not having much experience with it. Well, we know that part of the thing that keeps us sane and workable are fundamental beliefs about life. We have to believe that the world is a safe place. There's some times it gets us, but we have to believe that. The world has meaning, it's safe, it's predictable. As an individual, I am worthy, lovable, and competent. When people are trustworthy, my relationships are valuable, and others value me. These are on the beliefs, the truths we have to live by. What do we see in the COVID-19 pandemic? Everywhere you go, anywhere in the world, fear, worry about the future, grief and loss. Everybody knows somebody that had it or is gone because of it. The areas of impact from the COVID-19 are socially, working with people, psychologically, mentally, how it's affecting us, and economically. Millions of people out of work immediately when this happened. A lot of them just starting to come back. Again, the increased reports of, and we talked about this a little earlier, anxiety, irritability, anger, depression, insomnia, sleep, family conflict, loneliness, isolation, excuse me, fatigue, poor health behaviors, reduced activity, snacking, emotional eating. Some of these are quotes from the writing we're doing right now on COVID-19. So the 5 signs of a normal stress response are physical, cognitive, behavioral, emotional, and spiritual. Take them one at a time. Physically, we're going to be tired, exhausted, poor sleep, nightmares, appetite problems. Cognitively, we're thinking all the time, ruminating, poor attention and concentration. Kind of thing where you walk across the room and get over there and wonder what you went for and come back and go back again. Confusion, forgetful, what ifs. Behaviorally, decreases our libido. So we're socially withdrawn. We avoid talking about the stressor. See a lot more drug and alcohol use. Emotionally, we see irritability, and when we experience irritability, we're easily frustrated. Fear of losing control and attempts to maintain control, always the pressure we work with. Spiritually, get to questioning beliefs, or the other side of the hyper-religious, lack of trust, feeling abandoned. Frequency and duration of these dissipate over time, but they come back again too as you go through more things and more problems. When stress becomes distress, our typical stress symptoms are exacerbated and ongoing with no reduction. When symptoms continually interfere with our normal daily functioning, and when there's a significant delay between onset of symptoms and the event. And it's been going for 3 months now. Who would think you catch it now, but you're still out there, still coming one-on-ones. Communicating about COVID stress responses. As a helper, you need to explain your reaction. The mind interprets the situation as a threat, responds with the nervous system activation. Started that already, and I'll cover that one more, but that is your unconscious trying to balance this in your mind so that you can handle it. You're experiencing a normal response to an abnormal event. We working with people, we normalize their reactions, help them build coping skills, Help them connect to resources that can help them process it farther. And resilience, main word working with the recovered folks today. Resilience by definition, an ability to recover from or adjust easily to misfortune or change, from Webster. Research suggests that those that possess these qualities fare better during times of adversity and threat. You're adaptable, you're optimistic, and you have psychological flexibility. If you have those three, you're more likely going to get through this pretty healthy. The face COVID came from Russ Harris in the book he just put out on the articles on COVID. F, face. Focus on what's in your control. Don't worry about what's out there. Do what you can do with what you've got. Acknowledge and verify your thoughts and your feelings. They are normal and they are adjustable. C, come back into your body. Just make sure that you're taking care of yourself. Make sure that you can manage yourself so that you can manage others. And E, engage in what you're doing. We all do overly, but just those 4 points really help us process and get into facing COVID. And the COVID part of that is committed action. We have worldwide committed action on what we're doing. No matter where you work, where you call, my friends in Ireland doing the same thing as here. My friends in Australia doing the same thing as here. So the O is opening up, being able to talk about it, getting other people to talk about it. The V is values. Identify the values that you have that help you get through this. And also those resources that are available that you maybe did or didn't know, but that you're able to use or able to provide. And D, disinfect and distance. That 6-foot rule is going to go for quite a while yet. And washing your hands, making sure you get the disinfectant on as much as you can, all help us work it, process it. What are we seeing in the survivors of COVID? We're talking to one right now, but here we know that psychological aspects of recovery include anxiety, low mood, fear of further illness, and hypervigilance to body symptoms, nightmares and flashbacks, poor sleep, impaired memory functioning. Again, that just you're overwhelmed to the point where you wonder what you're doing many times. You have to double check and triple check. Did I turn that on? Did I turn it off? And so on. Effects on attention, mental and processing speed, and executive function. The brain is really overworked and overwhelmed right now. If you don't have it, and you're working with people that do have it, it's even more so. There's a fear of stigma and impact on social isolation. If you've got it, are you going to get it again? Are you more dangerous? Should we not be around you? Whatever. Practical strategies for managing stress during COVID. This is all compassion fatigue work, folks. Media exposure, just small doses. Don't glue yourself to that box forever. Just listen for 10 minutes and shut it off. Get a different routine. Your routine has been changed, so you need to get a schedule that in your mind. Once we can get things going the way they should go, and we've got a time and a spec, we can process things a lot better. Practice daily movement, maintain social connections. It's much harder to do, but reach out. Plan simple pleasures, daily pleasures, something with family and something on your own. Practice daily relaxation and self-soothing activities, something that's good for you. Avoid catastrophic, obsessive, or ruminating thoughts. Not going to do us any good and can hurt. Practical mindfulness. What is good for the goose is good for the gander. Take care of yourself. Discuss concerns, practice active listening, practice psychological flexibility. Engage in creative expressions. Let go of perfection. It doesn't have to be exact. Just get it done. Have family conversations about what to expect. Build hope and optimism. We can see the light at the end of the tunnel. Take time for activities you seldom have time to do. Maybe some work backed up that you now got time to do, you can process it. Connect with your values. We'll talk about signs, symptoms, and strategies for a while now. Signs of compassion fatigue in COVID specifically, but in the world. Diminished sense of purpose and enjoyment of the career, just kind of goes down the drain. Reduced ego functioning, that's time, volition, and identity, language, cognition, all of those go down, reduce. We're not doing them as well as we usually do, or as well as we could. Lower functioning in non-professional situations. So not doing things we typically do because we're overwhelmed from the compassion fatigue. We do find a diminished capacity for intimacy, just kind of some leave me alone stuff, because right now everything else is still running loose in the head, and it's hard to process it. And we might find loss of hope. Other symptoms of compassion fatigue: diminished capacity to listen and communicate. Really hard to focus with my clients right now, just for them to focus and for me to focus both. Subtle manipulation of discussion to avoid painful traumatic materials. Loss of confidence and diminished effectiveness and dread and empathetic reactions are all costing us. And the line between the victim and the perpetrator is narrowed considerably. What's it mean? Doesn't mean you're inadequate. It doesn't mean the client's inadequate. It's an occupational hazard for trauma workers. We know we're going to get into that if we don't volunteer where we go. It's occupational hazard. And it works for us because of our strengths, our empathy, involvement, helping, and humor, I would add to that. Mary says, the more you bring in, the more you pay. And that's true, but the more you've got to pay with. Risk factors. Combination of exposure to extraordinary trauma and material and empathy. You put those two together, you're going to be much more likely to be in trouble. Unresolved primary traumatic history of our own. Things we've been through that we haven't processed are going to come back. Exposure to children's trauma and childhood trauma of adults. I'm going to find that avoidance is one of the primary coping strategies that we will use and that they will use. Other risk factors. We are emotionally vulnerable due to the inadequate or disrupted social support or due to recent significant losses, them and us. Primary traumatic experiences post-exposure. So what's happened since this started or since you've had the infection. Going to see limited work satisfaction. It just isn't as good as we don't get out of what we typically got out of it. Limited stress management and poor self-care go hand in hand. If you've got a friend that's the neat person always working right and all of a sudden they're not, that's compassion fatigue. How do we know we're stressed? What's the cost of caring? We can talk about the chemical and physiological stress reactions. When your body goes into the stress reaction, there's 132 chemicals that mix in your body. Kicks in the fight or flight and quite a few other things. We'll talk a little bit about that. But first, I want to share the reasoning part of the brain is the front of the brain. This is generalizations, okay? The middle part of the midbrain is the emotional part, and the brainstem is the lower part. The 132 chemicals that mix when your body goes into the stress reaction act the same way as does alcohol. So let's take alcohol first. The man takes a drink, the drink takes the drink, the drink takes the man. The first thing that's overwhelmed is the reasoning part of the brain. That's why it doesn't pay to argue with a drunk, because they can't reason. They're working from their emotions. And if they drink enough that the emotions are overwhelmed, all that's left is the brainstem, the liver and lights and lungs, the things that work automatically. And if they drink enough to shut that down, they die. Stress acts exactly as does alcohol. If you get into an event that's really overwhelming, the front of your brain shuts down. Anybody's, everybody's. You're working from the emotions. That's why, as crisis intervention specialists, our main job, especially on the ground, is to get them back to the front of the brain. Watch their eyes, read their emotions, ask thinking questions. If you see it start clicking, you can see that the eyes catch on. You're bringing them back to reasoning, and then you can work with them. If you can't, and they're working from emotions and they get overwhelmed, they're going to go down to the brainstem, and we can die from stress. It's very well noted. There's a chemistry of survival. It's been about 50 years now. We've known about this and put it together. I helped write a book on it even. 3 chemicals that activate so that we survive in any given event, anyone in the world, are catecholamines, corticosteroids, and indigenous opioids. Catecholamines, these are the reds, the uppers. They excite the system, trigger the increased nervous system, kick in the fight or flight response so that we either run or we can do whatever we need to do to make sure we survive. Corticosteroids are the secondary of chemicals, kicks in the fight or flight, helps us survive, moderates and controls extremes of the catecholamines, except that herein lies the first problem. The greater the corticosteroid need, the less catecholamines they're going to be able to manage. And if it's a full-blown crisis reaction, the corticosteroids will shut down when we need them the most. The third area of chemicals, and the one we notice mostly, are the indigenous opioids. As pain thresholds expanded, blunting of emotions, euphoria, dissociation, amnesia, all these things happen because of the indigenous opioids. It's kind of mentally expanding and mentally escaping. So give you an idea, one of the things we know is from the indigenous opioids is there's a great heightened threshold of pain. How many of you have been hurt in some type of an accident and didn't know you were bleeding until you saw it? You saw the blood running. I've worked with officers that are shot that didn't know they were shot until I told them they were shot. That heightened threshold of pain. Another thing is we have the dissociative reactions, feelings of euphoria, really out of place chemicals, signs that show up. And I'll give you an example of that. My wife was killed in a car accident a number of years ago. And story is we had a daughter that needed treatment. We were going to Fargo about once a week, about 100 miles. And she would leave early, just 5 minutes before we would, park her car at school where she was working, and then we'd pick her up, go out to Fargo and come back. From our house about 4 miles into town, it was a little grade and up a big hill, down a big hill, up the hill again and into town. So wife took off, and 5 minutes later, we got in the pickup and started, and we got to the top of the hill and looked down, and my child said, "Dad, that's Mom's car in the ditch." I could see that it was, and I couldn't see what else was going. There's a car on each side of the road wheels pretty well still spinning. So I pushed her down on the seat in that pickup. And as I tell you this story, I can feel her hair in the palm of my hand right now. That sticks with us. Was my wife's car. I'm coasting downhill and I'm trying to hold the daughter down so she doesn't see my child. And we coast a little past the event so she can't see out. And a law enforcement dude from the little town comes in and parks between my vehicle and hers. And he said, Case, don't go there. So he walked over and come back and said, Case, don't go there. Be gone. And I guess he said, what do you want to do? And I guess I said, well, I should probably call the in-laws. So he flagged down the car, taking me into town, and took me into town. This is 6 in the morning, so I get to the other side of this little town and get to my friend's house and go in, knock on the door, wake them up, call the in-laws. I guess I don't remember, but I'm told that I did. And then got back in the car, left my wife with them, or my child with them, and went back to the accident. The next thing I remember is a few hours later, my buddy driving me home from the accident. About a month later, I had a young fellow come in my office and he said, Mr. Casey, do you know who I am? And I said, well, you're one of the Lapnoy boys from Monaga, ain't you? And he said, yeah. He said, I'm the guy that gave you a ride into town that morning of your wife's accident. See, I'm glad you stopped. I'm glad. I didn't remember who that was. I really want to thank you for that. And he said, what do you remember about it? And I said, well, I remember getting in the car, daughter sitting in my lap. I remember getting to my friend's house and going up the little hill to his door. And I remember you looking at me kind of funny. He said, yeah, you were singing nursery rhymes the whole way into town. I said, Mary had a little lamb, old MacDonald. Why was I doing that? Feelings of euphoria, dissociative reactions, blunting of emotions. I wasn't going to, my brain was not going to let me go there. So you might be working with people in crisis and you're going to see that. Another thing, when it mixes with the catecholamines, indigenous opioids, it sometimes causes amnesia, sometimes short-term, sometimes permanent amnesia. And people also dissociate. And of course, I have another short story quickly. Wildland firefighter for 25 years. About 5 years into my work, I was assigned Western fire duty. So all my non-snow months were west of the Mississippi and about 5,000 feet. First assignment, I worked for a little Native American named Jimmy Groot. He was a great guy, friends right off the bat, worked together for 10, 11 years. And in fact, we were the same rank. He worked for his organization, I worked for mine, and I worked under him, and he gave me just an average rating the first time. And I said, what the hell are you talking about? I worked as good as you did. And he said, no. He says, if I don't give you that, I can't raise you up next time, so you won't get a raise. Oh, okay. Anyway, 10 years passed, and we are working on the same fires. I worked with him as often as I could. On this fire, we're both division supervisors. And division supervisor he was in charge of a certain amount of line. We each had 1.5 miles of fire line with about 100 people working our fire lines on each side. And our job as division soups were just to make sure everything was okay, it was safe, and everything was going like it should. Well, we met a couple times as we're walking back and forth. We had lunch together and decided to walk out together. The division soup is the last person off the line. You say, okay, time to go back to camp. Everybody leaves, we check it once more, and then we walk out. We decided we'd walk out together at that lunch, so I waited for him and come up. So we caught up a little bit, and we walked, started walking back to camp. Got, I don't know, 15 minutes or so, and Jimmy said, I got to take a whiz, Case. So he stopped and I walked another 15, 20 feet and standing there. And I need to explain one other piece of this story for you to get the picture. most of the West is covered with ponderosa pine, which is a weed tree. By the time it gets 35 years old, it's hollow. The needles are really full of oil. And when you get into a pondopine burn, the trees burn completely. All of the branches are gone, all the needles are gone. And when we're doing mop up, we mop up by hand because there's a lot of those with fire inside. Well, once you start doing mop up, once these trees will fall down, they'll burn through and fall over on their own. There's no noise to them because there's no wind resistance. It's just a pole coming down. The Indians call them, I forget the name they have for them. Virgin. Anyway, Jimmy stopped. I walked off. I heard a thump. I turned around. Angel wings, that's what they call them. And Angel wings had Jimmy nailed to the ground. He had a blunt 8-foot or 6-foot piece into his chest. There was nothing I could do. The next thing I remember is waking up in the nurse's tent at fire about 3.5 hours later. They said, I walked into camp all right. I told them the whole story. They took me down to the nurse's tent. I don't remember any of that. That was blunting of emotions, amnesia, dissociation. I still don't remember any of it. They told me what happened, but I still miss a big piece of it. All of that happened because my mind said you didn't have to remember that. You don't have to go there. So with that now, we'll talk about the good and bad of stress response. Good things that happen, thyroid kicks in. All of these things start up over time. Everything's working at peak performance. The negative side to that is that you're not going to be as good as what you do for as long. You're going to burn out faster. Endorphins, nature's opioid. As soon as your body goes into stress and 132 chemicals, you're going to do things that would hurt bad other times and you don't even feel them. This one also burns out. When it does, little hurts become big. That old football injury's got you limping again. That broken shoulder is hurting again. All of those things because the endorphins usually take care of that, and now they're gone. They're overwhelmed. Adrenaline. Adrenal glands kick in to immune cortisone kicks in to protect us from allergic reactions. However, it depletes our immune system and the body goes into the starvation mode. So one thing that happens is you're going to really be hungry. Even though you eat, you're still hungry because the cortisol levels are gone to cover that. It's reducing sex drive. This is important in some places, not in most, but menstrual cycles are disrupted, erectile dysfunction happens. When this happens, your unconscious is saying, that's not the most important item on the agenda right now. That's still going to work sometime, but right now it isn't going to. And I share this because sometimes if you a long drawn out thing like we've got with COVID-19, very likely you're going to see this one. Blood sugar levels are increased for short distance energy. We don't last as long, but we have much more energy to do what we need to do for survival. The only bad part I say when I'm talking about this one is it's tough on diabetics. If you're diabetic, you'd better be checking your numbers a lot more often. Cholesterol levels are increased. With blood sugar, your unconscious has just said to the brain, has said that the body start making more sugar. With cholesterol, it says to the liver, start making more cholesterol because I need that when I run out of blood sugar for short distance energy. However, with this one of the two, this one doesn't shut off. Once the cholesterol level's up, if it isn't burned, it stays in your system. And I guarantee you, after 15 years of doing some kind of stressful work, you're going to need some replumbing. Lungs. We're collecting more oxygen so that we can breathe deeper, manage things better. We've got more oxygenated blood in our system, so we're feeling stronger. Only bad thing I found on this was smokers. Most of us were smokers when I was working, and the medical folks would tell us for the first 2 minutes in any given fire, you've got an advantage because you're used to smoking your lungs. After that, it becomes a disadvantage. The heart told that it's going to have to pump thickened blood, so it's going to have to beat harder and more faster. If you've got a bad heart or high blood pressure and you're on a stressful job or work, I guarantee you it'll take you out sooner or later. You'll be having some replumbing done. Skin is the largest organ on the body. It's the one that protects us most. How many of you have been driving down the road playing the radio, picking your nose, whatever you're doing, and notice the car in front of you, you don't notice it stops, and you miss it by an inch, and you say a prayer for that person, right? And you ever get that real hot flush or the cold flush? That's your skin saying, I just tighten up so that we could survive. If you go in and out of stress a lot, your skin is going to become oily, dry, scaly. You go to the doctor for psoriasis and they'll say, no, that's stress. And it very typically is. Last of these, all of your six senses become much more acute and focused. So you survive. You're much sharper on everything. The bad part of that is you're more prone to accidents because you're so focused on what's happening there that you don't see here. In fact, they tell us that Philology Institute who studied this for 30 some years, and they tell us that the outside 30% of your eyes shut down when your body is in full stress response. So all we've got is that 40% right in front of us. Also, as your body becomes overwhelmed from the event, your unconscious, your best friend, starts shutting down your senses. It's a survival tactic that's built in, and it'll go from 6, 5, 4, 3, 2 to 1. And for most of us in this hemisphere, that one is vision. So if you've been through a bad event and you go to sleep at night, you might sleep or you might not, but when you wake up in the morning and the event comes back to your mind, the first thing you're going to have is a picture just as clear as it was when you first saw it. Now, during the first sleep after a given event, your unconscious will put as many of those senses back as it can. So when you wake up the next morning after an event, you're going to have the best memory and the purest memory you'll ever have of that event. A lot of law enforcement agencies, if it happened today, write it up today, turn it in the morning. What you add in the morning is still fact. After that, it becomes fiction or fictionalized. Okay. Keys to stress management. How do we take care of ourselves? Watch our diet, exercise, let it run in our head, practice deep breathing techniques, and identify compassion fatigue if you need to process it. Well, very quickly, diet. Mind what you eat. Focus on high protein foods, raw fruits and vegetables, things like that. Low sugar, low fat, low salt. Stay away from the carbs. Every carb that you don't burn is going to stay with you. So you can be under stress, eating and put on weight. Cortisol levels rise when stressed, causes our immune system to deplete, and our brain tells our body we're starving to death. So you can be completely full and you're still eating because your brain says they need to. Exercise. Those 132 chemicals that kicked in because you were in as a stress response, the only way you get rid of them fast is sweat. So guidelines, if you have a high stress job, exercise to half an hour full sweat every other day. Just keep processing exercise all the time. Get physical therapy massages to help you process it too, because memories are stuck somewhere in our body. And I guarantee you, if you've been through an event and you go to a therapist and they start giving you a massage somewhere in your body, when they're rubbing that, you'll weep. That's where it's stored. Let it run. Your unconscious has to find a fit for this in event new memories that you can accept. It'll run as you request or when it feels it can. You control it. If it's safe for you to let it run, let it run. If it isn't, Kubler-Ross gave us a tool 50 years ago saying, tell it your unconscious, nope, Friday at noon. And every time it comes up, nope, Friday at noon. Then Friday at noon, give it half an hour, and let it run, and then say, next Friday. It'll process a lot of it in your subconscious or unconscious. Deep breathing techniques. Practice deep breathing techniques. Philology Institute has been pushing this for over 30 years. The best thing we could do for ourselves is learn to breathe by the numbers. And so practice deep breathing. Breathe into 6, breathe out to 8. Because a lot of us have maybe a third of our lungs filled with carbon dioxide. And if you breathe in and breathe out more than you breathe in, you'll push that carbon dioxide out. You'll have more oxygen to the brain, so you're able to think better, sleep better, work better just by practicing. So practice however deep you can breathe and then blow out more than you blow in, and you will be able to tell in a very short time that this is helping you process it. And after the book says 10 or 11 days, if you practice it every day, it becomes innate. You know, my ex used to hate going to the airport with me because I get there, I'm all stressed out. I got to get through things. I got to get my book, got to get through security, got to get my plane. Now, when I get to the airport, before I even open the door, I realized I'm counting. My breathing is running by counts, and it's saying to myself, you don't have to do that, dummy. Just slow down. And so I do. So practice deep breathing techniques. When you don't need it, it'll be there when you do. The last thing on this slide is the compassion fatigue. That's the cost of caring. It's how much of ourself we invest in what we do. And that's what this whole hour talk is about, is the compassion fatigue level. So we'll give you a few more things to do about it, but these things I just talked about now, these keys to stress management, if you follow these, it will help you a lot in managing that stress management. This is something I use when I do the compassion fatigue training. It's a long sheet, but I know I'm headed for trouble when, and this is a good thing to you just copy and have on site. If you've got something going on or there's an event that's bothering you, fill out 1, 2, or 3, or 4 things that I know this is an early warning sign. How do I know? Maybe I'm thinking about it too much. Maybe having 2 extra beers tonight because of it or whatever. And then the other part of this is, after identifying those, am I willing to, the self-care part of it, the second half is, am I willing to ask for help? Do you know what to ask for? Do I reevaluate my priorities? Can I identify what is most important and deserving of my focus and go there? Can I let go of that which distracts from my ability to focus? This is a real handy slide to have, or a piece of paper to print and have when things are going not the way you like to have them. And I just threw this in. This is a development of EMDR, eye movement desensitization and processing. The Israeli and French spent about 5 years studying this and found that by doing simple tapping, they can help you process the emotion that's stuck on the event. And so this is the guidelines very quickly how to do it. If you come across somebody who did it, or for instance, I open all of my trainings with this. Anybody got anything going on with them that's bothering them? And if I've got 10 people in the room, 2 will hold up their hands, I guarantee you. And so I ask them to think about it and then identify how bad it's bothering them. So 1 to 10, I have them take a deep breath, and then we do tapping on the hands, on the shoulders, on the knees. You tap till you see a reaction. Ask them where they are. Take them down through the subjective units of disturbance from 0 to 0, and then scan it once more, develop it, present it, and give them your card in case they if they have any questions about it. If you're interested in this, please let me know, and I can send you a good handout on it. You don't have to be a mental health professional to use it. In fact, when I deploy, all of my team, no matter who they are, do use this tool. So as a review, compassion fatigue is secondary traumatic stress. If you've got it, you've got difficulty separating work and personal life. You've got a lower frustration tolerance. Things that don't usually upset you can really get you. Dread of working with certain clients. There are certain people that the farther I'm mixed in with compassion fatigue, the less I'll work with them. And I'll tell them, I can't work with you. We see a disruption of one frame of reference. Our sense of identity, worldview, spirituality, all of these things are going to be affected. Maybe not changed, but affected by compassion fatigue. And what we find is people typically use ineffective and self-destructive self-soothing behaviors. So we have, I had a fellow working for me that in the office when I worked with the state, started disappearing from about 11 to 2 every day for his half-hour lunch. And I was in a neighboring town one day, I saw his vehicle parked behind the liquor store. So I went in and asked him how he was doing and what was going on, and talked about it and said, we need to do something about this. And he agreed, and his wife was leaving him. He had said no word to nobody, but she was taking the boy and leaving, and so he was going to be alone. And that's how he tried to manage it. So mind that. Can we prepare you to recognize stress in yourself and others? Hopefully you picked up enough from the slides. You'll have these for compassion fatigue triggers and early warning signs. And I need to identify and utilize resources and plans for resiliency and prevention for yourself. That's what I'm hoping you get out of this. I'm hoping you'll sit down and say, okay, here's what's bothered me, and here's what I can do about it. And here's what I can't do about it. And here's who I could ask about it. And this is how I manage it. So, from the organizational standpoint, what should we be doing with organizations? Pre-incident education. Identify compassion fatigue as a secondary traumatic stress and can lead to burnout. Identify what resources are available to assist employees. What protocols are used for utilizing the resources? How do you call them up? How do you get them here? Provide training for support personnel to assist employees. And a big one is recognition and affirmation for prevention measures. You know, when I deploy, whoever team leader, we meet every day, and part of that meeting every day is to identify something that somebody did that was really good. They're different, and it won't be the same person every day. But if I've got 5 people working with me, I'll try to pick up something each one did, or ask for it, and they will work with it. Prevention and also recovery, managing it for ourselves, essentials. We really have to be honest with ourselves and with others. Tell it like it is. A spade is a spade. I see you're not going to like what I'm telling you, but I'm telling you you're affected by this. We need an internal locus of control. We need to be able to process our stuff from ourself, not from outside. Intentionality versus reactivity. Instead of reacting to the thing, come in with the intention of managing it before we get there. Take care of ourselves physically. Keep a social support going. Reconnection all the time. If you deploy with me and I'm the person at home, I'll contact each one of your families every day and just tell them how you're doing. If you're out for 3 weeks or a week, no matter how long it is, we connect so your family is connected, so that when they get home, you get home, you're going to be able to talk to them about it. And that constructive self-soothing behavior as opposed to the other that we talked about. What do we do for ourselves? Life balance. Balance out work, rest, play, alone time. Need to see appropriate grieving. Non-anxious presence. Don't be on edge coming in thinking you're going to save everybody. Just come in and talk to them, let them know you're there, ask some questions, see if they want to talk, and so on. Self-validated caregiving. We see the things you're doing for yourself and we want to identify that. One of the things we know that whatever troubles you had before you deployed, that needs to be resolved in your head or physically if you can before you deploy. Otherwise, it's going to be working with you, against you. See a consultant, get supervision, and debrief regularly. And also set appropriate boundaries, what we'll do and what we won't do. The information for this course, last two sheets are the APA, the COVID Act, headspace.com for COVID-19, and the J-Manic works journals listed here. And a list of references. The people that we're expecting to watch this really like to have references to go back and see what more they can pick up. So that's what this is for. And that's me. If you want to contact me, any questions anyone has, please feel free to do that. Go on my website if you're looking for training and so on. Thank you very much. Thank you for your time, patience.